Hey, so after you have finished the intake and your initial diagnosis of the patient, the next step is to make your treatment plan. Your treatment plan is really important because this is what you're going to be pulling from as you are going through counseling sessions to test your progress and to make sure that you're moving in the right direction. So there are three parts to a treatment plan. The first one is goal. The second one is objective, and the third one is intervention. So when you are making a goal, we use what are called SMART goals. The S stands for specific, the M stands for measurable, the A stands for attainable, the R stands for realistic, and the T stands for time sensitive. It's really important as you're building your goals and your objectives and your interventions that these things are attainable. Right? Not in 6 weeks, the patient will decrease anxiety by everything that you've ever done. Okay, so let's take a look at the first goal. This is a build rapport goal. To build a rapport between the therapist and the patient. Very simple, very specific. Now, let's get into the details of that. When you have the objective, this is what the clinician will do. Okay, so this one says the clinician will listen actively while displaying empathy by mirroring the patient and providing interactive feedback, right? Those are all interventions that the clinician will use, okay? Now, let's go down to interventions. These are things that the patient will do, okay? So the patient will attend sessions weekly and share disappointments and desires honestly with the counselor for 6 consecutive weeks. So do you see here that the time sensitive part, they will attend sessions weekly for 6 consecutive weeks, right? Now, that is that time specific and that time sensitive, and it's very specific. Now, a lot of times we'll have more than one objective. The second objective we have here is the clinician will use an eco map and motivational interviewing to help the patient identify their natural supports and encourage the patient to share their takeaways from counseling between sessions with safe people they can trust, right? So this is what we want to be doing as clinicians. We want to be pushing people to the relationships, the natural relationships in their life in order to receive support that way, so that when they have completed the counseling process, right, once they have learned these tools, they can continue these conversations, continue their work with the people in their life. The intervention that we have for objective 2 is the patient will identify one natural support in their life and commit to sharing one counseling takeaway with that person 75% for 4 consecutive weeks. So here we have the patient is going to do their part. Now, do we want them to just do one natural support? No, we want them to do 5 natural supports. Right? But again, we want this to be attainable. We don't know with any particular patient how many natural supports they have, but what they need to have is at least one. So now we're going to go on to another goal. This goal is for trauma. This goal says the patient will explore how trauma has impacted their story throughout the duration of therapy. Okay? Now we have our objective. The clinician will teach RFR, brain psychoeducation, to explain the process of the nervous system reset and model somatic coping skills in weekly sessions, right? So here we have the clinician is going to teach them the somatic coping tools that they're going to need as they explore their trauma, okay? Intervention. The patient will practice somatic coping skills independently outside of therapy 3 times weekly for 6 consecutive weeks. I can tell you from experience, this does not happen right away. It might take them a few weeks to get into the habit of practicing these coping tools on their own. Objective 2 we have for this trauma goal is the clinician will use the pillars of narrative-focused trauma care, attunement, containment, and repair of rupture to identify deficits in the patient's attachment style, explore their family of origin, and connect parts of their childhood narrative and current gaps in their relationships. This is super, super important because again, We can deal with behaviors all day long, but unless we connect those behaviors to childhood, to attachment, to where they first began, to where we learn those lessons, it doesn't help us unearth the root of what's going on and how our trauma is affecting our everyday life. The intervention for this goal is the patient will retell portions of their childhood narrative and share it with a friend, family member, or therapist within a 6-month time frame. Okay, so this is that trauma goal. Now, your goal can be about anxiety. Your goals should always be person-centered, specifically for that person. In order to address trauma, you could be using our timeline intervention. You could be using CPT. You could be using TFCBT. You can be using all the T's and the B's and all the things, okay? But this is just one example of a trauma goal. Now, let's get to SimplePractice and how to actually use this and create your treatment plan in SimplePractice. So here we have our SimplePractice. This is good old John Doe. He needs a treatment plan. So what we're going to do is we're going to click on John here, and we are going to go to add, well, we'll just click on his name. You can also go to add note though. So what we're going to do is go right here where it says new. Right here, we're going to put in a new diagnosis and treatment plan. Okay, now what we're going to do, we're going to go ahead and for John, we're going to put in adjustment disorder unspecified. Okay, now this is something that you'll have determined after the intake and went ahead and processed. Okay, now what we're going to do is we are going to go ahead and save the diagnosis. Now we're going to select a treatment plan template. Now, the one I'm going to be teaching you and walking you through is the advanced. This is creating a step-by-step treatment plan. So the first thing we're going to present is presenting problems. Okay, so the presenting problem is John, let's see, the patient is struggling. Don't do that with my spelling. Don't judge. So he's struggling with current relationships. Continue to behavior. This is what the behavior looks like in his presenting problem. Okay, the presenting problem could also be trouble, all the things. Presenting problem. You with me? Okay, behaviors. The patient has regular angry outbursts. Okay, now we're going to go to our goal. So here's our first goal. So we're going to go ahead and pull from what we already did. Let's go ahead and do our build rapport goal. Okay, first goal, boom. Now, if you want to do a second goal, you're going to hit this plus sign right here. So let's go ahead and do that and do our second goal. Down here, patient will explore how trauma has impacted their life during the duration of therapy. Second goal. Now what we're going to do is continue to objective. Just for time's sake, we're only going to do one objective for each goal. So objective 1 for build a rapport goal, we're going to come right here and say, the clinician will listen actively while displaying empathy by mirroring the patient and providing interactive feedback. Okay, then we got to come down here and do our objective for second goal. And boom. Now we're going to go ahead again. If you want to add that second objective, all you do is hit this plus sign and it'll pop up. Continue to interventions. So now we have interventions for first goal. So let's do the patient will attend sessions consecutively. All right, and interventions for our trauma goal. The patient will practice using somatic coping tools. Okay. Continue to overview. Now, this is one of the reasons why I use the advanced version, because this is really, really helpful when you need to look at a whole treatment plan. When you do the simple treatment plan, honestly, it's a little more intimidating because it's just a blank box. The advanced really walks you through the objective, presenting problem, like it basically lets you know everything and where to put it. So what we're going to do is we're going to cheat a little bit, and we're going to actually copy and paste all of this treatment plan. Okay, we're going to go ahead and copy it. We'll use it in a second when we're making our progress note. Treatment frequency. When you are beginning with a patient, you should always begin out weekly. As you build rapport, as you kind of get into their story, it's really important that we spend that time regularly and consecutively with the patient. Remind to review plan after 90 days, complete and save. All right, John is doing amazing now. Okay, so now let's come down here. John had an appointment June 10th, and it's so weird because notes are due within 24 hours, but we didn't do the progress note. So now we're about to do that. So progress note, same thing for the notes. The progress note is really, really important. When you see the simple progress note, as you see, empty box, it can be really intimidating. But what we're going to do is we're going to use the actual progress note. This gives us a lot of different options, asks us a lot of different questions, and really walks us through. Now, we are going to answer coaching. No, we're doing counseling. And remember, we copied and pasted that treatment goal and the whole treatment plan. Guess what? Treatment goal. Boom. There is his whole treatment goals, interventions, and objectives. Okay. Treatment goal progress. This is his first appointment, so there's no progress yet. The intervention. Now, the intervention, and we'll read it right here, what the therapist did in session, how evidence-based practices were used to help the client reach the goal. Okay, so we're going to head back here for a second, and we've got our interventions right here for the progress note. Now, our intervention is going to be the clinician listened actively while the patient did a brief check-in about their week. The clinician displayed empathy and engagement by mirroring gestures and providing interactive feedback. Now, the reason we have this as a base is because this is something that you pretty much do every single time. Now, this is not your entire intervention. This is where you also want to mention the clinician proposed some of that coping skills, the clinician administered ... assessment. This is where you want to give the things that you did in the session. Okay. Now, here we have observations. So cognitive functioning, we're going to say that John was oriented and alert. Affect, we're going to say that his affect was appropriate. Mood, John was a little anxious this time, so we're going to go ahead and put anxious. Just a side note, if your vocabulary doesn't include this word, it basically means normal. Okay. So if John was doing fine, we would choose eurythmic. Don't judge me. Okay, but John was anxious, so we're going to use anxious. I know how to say that. So interpersonal, we want to talk about how John was as we interacted together. Was he guarded, withdrawn, hostile? We're going to say he was a little guarded today, right? It's our first session. You know, stuff is kind of like, okay. And functional status, we're going to say that John was intact. Now, risk factors. This is very, very important. Every time you have an appointment, you have to click what kind of risk factors there were. is John at risk for self-harm or other-centered harm? Okay. Now, John did not have any signs and denied any type of suicidal ideations or homicidal ideations. Can be weird to ask this question every single time, but super, super important, right? So now we're going to go down to whether or not John is on any medications. And John is actually on 20 milligrams of Lexapro. Okay. Now, current functioning, symptoms, and impairments. We're going to say that he's aware of person, place, and time. Overall symptom rating for high risk only. So this is if John did say that he was struggling with suicidal ideations, we would ask him from a score of 1 to 10 where he was on that scale. Okay, let's say John is a 0, he's not experiencing any of that. Just a side note, we're all clear that if John is experiencing suicidal ideations, what do we need to do right away? Assessment and safety plan. Reach out to your supervisors and your team lead in order to discuss that. We make no decisions in isolation, and at all costs, our goal is to save a life. So just a little plug there. Now, overall, his symptom rating for depression and anxiety. Now, we said he's a little anxious, so we're going to go ahead and put 4 right here. Okay. Now, this is a super easy way to note what kind of interventions you used. Okay. And this can be a nice little cheat sheet if you're wondering, like, man, I'm doing interventions. What the heck did I do? Oh, come down here, take a little peeky poo. Okay. So here we have cognitive challenging, cognitive refocusing, cognitive all kind of stuff. And of course, we have other. If you're using somatic coping skills, that's really important to put in other. Psychoeducation is a really great thing to add in here. So what you're going to do, let's see, when we were working with John, let's see, we did some cognitive reframing, right? We helped him reframe some of the things that he was struggling with. We already said that we use interactive feedback and motivational interviewing, but we also we taught him a somatic coping tool. And I'm going to put a little semicolon there, and we're going to say redirect. That's the tool that we taught him. Yeah, dope. Okay, effectiveness. Now, this is what the patient responded to our interventions, okay? So effectiveness, how did the client respond in sessions the interventions used? Was the client shut down, cried when talking about triggers? Client responded appropriately. So now we're going to hop back here to our stock words. Effectiveness, the patient was interactive and engaged. They shared briefly about their week and processed how it affected them. The patient responded well to interventions presented by the therapist. Let's go ahead and copy that bad boy, put it right in here. Again, this is not all it needs to say. You need to go ahead and say, what was their affect? Were they tearing up? Were they speaking very quickly? Did they have a shift in their face when they went from topic to topic? Did they avoid a certain topic as they were sharing about their week, right? We want to talk about how the patient responded to our interventions, okay? Then we have plan and recommendations. Now here, I usually use, when are we going to see them next? Our plan is going to have weekly therapy, okay? And then I go ahead and save this. When I'm ready, I'm going to sign it. Now, let me tell you, please, 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 please use your psychotherapy note. For me and my practice, this is the single most important part of a note of being a good therapist that you can possibly do, okay? And not everybody uses it, but this is my thing, and so I'm gonna break it down. So your psychotherapy note is something that is separate from the client record, okay? So this is not going anywhere official. This isn't necessarily going into their client file. And so one thing that's nice is that You don't have to use the client and the patient. This psychotherapy note is simply for you to remember what happened last session and where you want to pick up next session. So I always start out by saying last session. So, what happened last session? John, we're going to just skip John. We're going to say tripping over wife, leaving early, because his wife left early and John just started tripping about that. He was really, really angry. He got really, really anxious. And what we did is connect to being left as a child, okay? Then we did redirect tool. And then we're going to go down to the plan. So I'm literally just putting some little notes in there to remind me of what happened last session. And I'm going to show you why in a second. Now, what's our plan? Okay, so we did a somatic coping tool. And so whenever we do somatic coping tool, what I typically do is I'm giving them some homework to go ahead and practice on their own. So 2 times this week, redirect tool. Okay. And then what's the next thing that we're going to get into? Here, we kind of just started out, we're building rapport. Now, the next step is to kind of get into their natural supports. Okay, so we're going to say eco map, natural supports. Okay, and we're going to go ahead and save that. Now, what's fantastic about this is, let's say next week I'm going from patient to patient. I'm trying to remember, like, who is John Doe? Because obviously he's a new patient of mine. And what in the world did we talk about last time? Because I just remember that I forgot my coffee, right? And so what I'm going to do is I can go ahead and pull up his chart, and you can see right here is the last session. Now, could I go right here? This is appointment number 3. I could go to read more, and I could take my time and go through and read all the different things that happened in the last appointment. But guess what? I only have 3 minutes before my appointment with John starts. And so instead, what I'm going to do is I'm going to look right here at my psychotherapy note. And it says what happened last time, just a little something to jog my memory, very specific, right? And in my own language. If I have some shortcuts, or if you want to use text language, you can do all that in a psychotherapy note because it is not part of the patient's actual chart. Okay, so now I know 2 times redirect. That's one thing I'm going to ask him in the appointment. And if we don't go anywhere crazy when he checks in with his week, then the direction I'm going to go is to talk about the eco map and his natural supports. Now, if I got time, I'm going to actually go ahead and pull up a blank eco map with his name on it, so that when we're ready, or if we get ready to go ahead and go into that eco map, that I'm already ready to pull it up. We always want to have some intervention on deck so that we don't sit there, do a check-in, and then look at each other for a few minutes. Because some people will bring, like, I wanted to talk about this week. And some people won't. And either one is okay, but we have to use our interventions to get to know them and to hear where they are and to explore that story. So that is how we do a treatment plan, and that is how we do our progress note. Any questions? Raise your hands. Okay, cool.